Now, students, in today's lecture, we will study a muscarinic agonist, that is pilocarpine. The alkaloid pilocarpine is basically a tertiary amine. So, as compared to acetylcholine, this drug, this muscarinic agent, is far less potent, and this is uncharged. Because of its tertiary amine structure, this drug has ability to penetrate the CNS. So, pilocarpine is a drug that is widely used in ophthalmology for the treatment of glaucoma. Pilocarpine basically exhibits the muscarinic activity. So, here in this diagram, it is representing the structure of pilocarpine. This is the cyclic structure which are included in this. So, pilocarpine actions. Pilocarpine has its major action on eye. It has ability to cause rapid miosis, that is contraction of the ciliary muscles of the eye. So whenever there are contraction of the ciliary muscles of the eye, it means your eye is getting, your pupil is going to be contracted, your size of the pupil is going to be shrink. So this is called miosis. So here in this diagram, this is untreated eye with normal pupil size. So what is meiosis? Whenever there is decrease in size of the pupil, this will cause the meiosis as caused by the pilocarpine. Whenever there is dilation in the size of the pupil, this is called mydriasis, that is caused by the muscarinic antagonist, the substance which basically acts against the pilocarpine, that is atropine, that is muscarinic blocker. So this pilocarpine here also has the ability to cause the spasm of accumulation. Because of this feature, the vision becomes fixed at a particular distance, making it impossible to focus. So first effect was meiosis. Second one was spasm of accommodation, because of which your vision is get fixed at a particular distance and then it becomes impossible to focus. Now, this pilocarpine has ability to stimulate the secretions like of sweat, tears, and saliva. So, however, there is limited use of the drug because of lack of its selectivity. So, promoting salivation is the required feature in a disease, that is xerostomia. Xerostomia is a condition in which there is dryness of mouth. Those patients who are undergoing cancer treatment, radiation treatment, or irradiation of the head and the neck suffers from xerostomia, that is dryness of the mouth. In this case, the drug is beneficial in promoting salivation. Now, this drug is also used in Sjogren syndrome. What happens in Sjogren syndrome? This syndrome is characterized by the dry mouth and lack of the tears. So, in that case, you can use oral pilocarpine tablets, and there is also another drug, that is cevimeline, that can be used in that case. So the treatment for Sjogren syndrome is pilocarpine and this cevimeline. So, but what is the drawback of this cevimeline? This cevimeline has a drawback that this is a non-specific drug. It has ability to act as an agonist for both muscarinic receptors of M1 and M3 receptors. So, now coming towards the therapeutic uses in glaucoma. As I have already discussed that this drug has ability to cause the decrease in the size of the pupil. It has ability to cause the contraction of the ciliary muscles. So this is a drug of choice for emergency lowering of intraocular pressure, that is IOP, that usually occurs in case of glaucoma. So in open and closed angle glaucoma, there is always increase in intraocular pressure, and this pilocarpine has ability to lower this intraocular pressure. What this pilocarpine actually does, this is extremely effective in opening the trabecular meshwork, which is actually around the Schelem canal, so causing an immediate drop in the intraocular pressure of the eye, so resulting in increased drainage of the aqueous humor from the angles. So this section basically occurs within few minutes and can last from 4 to 8 hours. And now you can repeat this section. Now, precisely summarizing that what is the mode of action, this drug causes the contraction of the ciliary muscles. It opens the trabecular meshwork around the Schelem canal, thus helping in lowering the intraocular pressure of the eye. So, other drugs like topical carbonic anhydrase inhibitors, including brozolamide and the beta adrenergic blocker timolol, are effective in treating glaucoma but are not used for the emergency conditions. I have mentioned that you can use pilocarpine in emergency situations. So, meiotic action of this pilocarpine is useful in reversing the mydriasis due to atropine as well. And this atropine can be used to reverse the meiotic action of the pilocarpine as well. Now, what are the adverse effects? Adverse effects of pilocarpine include blurred vision, night blindness, brow ache, that is ache which you feel or the pain which you feel behind the eye or around the eye. Okay. Now the next is poisoning. So poisoning, what happens in poisoning? There is exaggeration of the all actions of the or features of the pilocarpine, which is the exaggeration of the parasympathetic effects. That is sweating. We also call this diaphoresis, extreme sweating, or this libation. So these are basically the adverse effect of the pilocarpine. So this was all about the pharmacology of the pilocarpine, adverse effect, therapeutic uses of the pilocarpine.